Good morning, good afternoon, good evening, depending on where you are in the world at this point in time. I would like to extend a warm welcome to all participants to this webinar about information on Global Health EDCTP3 joint undertaking. We have a full-packed agenda today. For the next 2 hours, you will hear from a number of colleagues from EDCTP3 program about EDCTP3, and this will comprise of several presentations, which will end into a question and answer session at the end of the session. So I really welcome you. This is one of the 2 series of info days that EDCTP3 Joint Global Health Program has organized, and we start today with the African session. And in April next month, there will be a European session. So welcome, and thanks for signing up and participating. I would like quickly to say about the evolution of EDCTP and come to why we are here. As you all know, EDCTP started in 2004, and the first program ran up to 2015, which was a program funded under Framework 6 and Framework 7 of the European Union, with a small budget of about 400 million euros and only covering TB, HIV, and malaria. Based on the success of the first EDCTP program, we entered EDCTP2 program in 2014, which will end in 2024, and some of the projects may actually extend to 2026. And this was a program that was funded to the tune of 1.3 billion euros and extended the disease coverage beyond TB, HIV, and malaria to include other neglected infections, including lower respiratory tract infections and other diseases that we call neglected infections. And where we are now, we have gone into the Global Health EDCTP3 program that started last year in 2022 and will go on up to 2031. And that has a budget of around 1.6 billion euros, but still covering the same diseases that EDCTP2 has been covering. So today you'll hear mostly about EDCTP3 program of work and issues to do with the EDCTP framework, which involves the association of countries and how to join those association programs. And as I mentioned, we would like to hear from you if you have lots of questions and need clarification. Next, we will want to know which countries you're coming from, where you are based now, or where you are based doing your work that is EDCTP relevant, and what is also your area of expertise. So you will see questions popping up on the screen in what we call a Slido poll, and we would like all of you, wherever you are, to participate, because this is very good information for us to understand the outreach of our info day today. So there you are. The first one is, in which country are you or is your organization based? I can see Netherlands, Uganda, United Kingdom popping up, Spain, Germany, Norway, South Africa. Uganda, some more African countries popping up. Mali, Côte d'Ivoire, Italy, Benin, Mozambique. Welcome.
Thank you all participants for responding here to the Slido poll. I'm Elmar Nimesgern, and while Tom may currently have some issues with his connection, I would just like to take over here because I'm actually also giving the next presentation. So thanks for all your feedback on the Slido poll. We have really quite a broad range of expertise and interests here represented. That's great because it also covers quite nicely the different priorities in our program. And so we have tuberculosis quite prominently. We have malaria, but we also have vaccines, so more horizontal issues. We have clinical trials. We have, interestingly, cold chain I see here. We have community engagement and user involvement. So that's all very good, because obviously we want to reach out and have results of our program reach citizens and patients. And yeah, so we have actually gene therapy here coming up. Yeah, and Tom, if you join us again, please take over. And yeah. Good. So really great to have you all, and even more feedback coming in. But I think generally clinical trials, grant management are quite prominent as well. And yeah, good. So I would suggest we just wait another minute or so, and then we can move perhaps to my presentation.
Hi. So can you hear me now?
Very well. And I stop my video and let you conclude this part with the Slido. Yeah.
Thank you very much, Elmer, for jumping in. I'm sitting in my South African office, and this is normal power blinks. And yeah, so it is very encouraging to see that we have been joined by a lot of people that really matter in the clinical trials ecosystem. Thank you, colleagues. This is really, really important for us. So we are now at the time where we are into your presentation, Emma. So me that was talking was Tom Nyirenda, Strategic Partnerships and Capacity Development Manager of EDCTP, based in the Africa office at Cape Town, and also a lead in the EDCTP3 program for Africa office. So Elma, please take it away with your presentation on the Global Health EDCTP3 program and the requirements of eligibility. Over to you.
Yeah, thank you very much for the kind introduction, and also thank you very much for actually managing our session today. And so colleagues are now bringing up the slides. Yeah, and in my, I think I have 5 or 6 slides. I want to give you just a short update on the Global Health EDCTP3 program. Tom already nicely introduced the history of this. And I want to really emphasize that we are very much building on the excellent work that has been done in the prior programs. For a number of reasons that don't have time to go into, we had to change the type of setup to what is called a Global Health EDCTP3 joint undertaking. And if I can have, thank you for the slide. So this was created from a policy level, really within the framework of 2 main aspects. One is of course, the United Nations Sustainable Development Goals, and there in particular, number 3, good health and well-being for all. I already mentioned the building on the success of the prior programs. We also have a comprehensive strategy of collaboration between the European Union and the African Union. And in that context, a number of policy, more detailed initiatives are launched. We recently adopted a global health strategy, and Global Health EDCTP3 program is very much established within the framework of that. Like for any activity at the EU level, we do need what we call here in the Brussels bubble a legal basis. For people outside, it's a law, a European piece of legislation, and you have the reference here on the slide. But for applicants, this is really not so important. For us running the program, this is indeed important, because this is what provides us the money, and it provides us also the framework within which we operate. And in that law, we have two overarching objectives that are mentioned as so-called general objectives. And our program aims to reduce the socio-economic burden of infectious diseases in sub-Saharan Africa by promoting the development and uptake of new or improved health technologies as number one. And as number two, we want to really work on increasing health security in sub-Saharan Africa, but also globally, by strengthening the research and innovation-based capacities for preparedness and response in order to control infectious diseases. And quite a bit of that has already been done in the prior program. This focus on the emerging infectious diseases is perhaps a bit stronger now. We have two partners in this. We have the European Union, which is represented by the European Commission, the executive arm of the European Union policy framework. And then we have the EDCTP Association, for which Tom and a number of other colleagues who will talk later today work. And it's really great to work with this association. At the basis, this association is composed of countries in sub-Saharan Africa. And since yesterday, we actually have 24 countries. And we will see, Michelle will present this a bit later, which is wonderful to see such a large number of countries already there. And we have 15 European countries currently member. We can also have ad hoc partners, which would join for a specific call or maybe two calls. That is really then a one-by-one decision of the governing board, which is the overarching decision-making body, and you will see that in later as well. And such contributing partners could, for example, be philanthropies, it could be industrial partners, or it could be other third countries. The budget was already mentioned by Tom, so we receive in our program up to 800 million euros from the European Union in cash. We also receive contributions from the EDCTP Association, which have to be at least 430 million euros. That is mostly so-called in-kind contributions, where the countries run calls for proposals, support infrastructures, and so on, which are very much in line with the program of EDCTP3. Then we also have these contributions from the contributing partners, and that could be up to 400 million for an overall budget that is quite substantial of 1.6 billion euros in the coming 7 years when we start calls. So 1.5 years we already have behind us, and we have another 5.5 years coming. And we talked today a bit an outlook on what we will do in 2023. If I can have the next slide. Again, already briefly touched upon, and I'm not going to read out all of it, but for those that might go back to this presentation and look at it later on, to have really the detailed description of what the priorities are. I should mention that this was defined, first of all, at an overarching level in our legislation, but then very much under the leadership of the EDCTP Association in a very deliberate and serious process running over several years. The so-called Strategic Research and Innovation Agenda of our program was adopted, and in it you have defined which diseases are addressed by our program. And the big, if I may call it that, the big three poverty-related diseases, HIV, AIDS, tuberculosis, and malaria, of course, tops the list. Then Tom already mentioned the neglected infectious diseases. We also address diarrheal diseases, lower respiratory tract infection, as well as the emerging and re-emerging infectious diseases that affect sub-Saharan Africa. Antimicrobial resistance is an important aspect in several of these cases. We also want to not forget climate crisis provoked changes in the infectious disease landscape. And we will also look at co-infections and comorbidities. And for the list of neglected infectious diseases, we do have a quite exhaustive list. And it's in the Strategic Research and Innovation Agenda, and it is also will be referred to in our work program. Coming to the eligibility requirements, this is really quite important, and I want to insist on this, that these conditions, as the slide here says, are cumulative. That means you have to fulfill all of them, meaning in order for any application to our program to be eligible, certainly at the full proposal stage, we need to have 3 legal entities, i.e. 3 research institutes or universities or companies, whatever type of legal entity, and they need to come from different countries. In practice, we very often have a bit more than 3, but 3 is the minimum requirement. This means you cannot simply apply if you are located in any of the countries that were listed in the Slido poll earlier. If you are with partners from your own country, this does not qualify you for applying to our program. You need to hook up and make a consortium with partners from other countries. And in that consortium, because our program is a collaboration, or is supposed to be a collaboration between Europe and Africa, you need to have one of those partners needs to be located in Europe, legally defined in a member state of the European Union, of which you know we have 27, or in an associated country that has signed an agreement with the European Union to join, and we have actually a large number of such countries, mostly in the European neighborhood, but we will later this year, for example, have New Zealand as a partner that is associated in the program. And you need to have one partner located in sub-Saharan Africa in one of the 24 countries that Michelle will show you that are members of the EDCTP Association. And since you need 3, actually, you would partners at least. This means you need either 2 Europeans and 1 sub-Saharan African partner country represented, or 2 sub-Saharan African partner countries and 1 European country. Beyond this core set of essential country, composition of your partners, of your consortium, you can then have other partners in other countries. That then becomes less important. So don't just make a consortium with as many partners as possible. It really has to fit with the scientific ambitions of the program and that you want to submit. And we have 2 types of what we call instruments. So basically this means different types of projects. In the research and innovation actions, it is where we support research projects, and we also have so-called coordination and support actions. There we support more the networking or capacity building. But these rules on 3 partners minimum apply currently for both types of activities. As regards this, what I talked about in the last slide was about what you need to, how your consortium needs to be made up in order for it to be able to apply. Then we have the different question is who can be funded, and there is of course some overlap here, but it's really a different. You have to first look at how you set up your consortium in order for it to be eligible, and then in the second step, you of course need to also look at who can get funded, and of course the same countries that were mentioned on the previous slide also can all be funded. There are some additional rules on eligibility which will be defined in quite some detail in the work program. So once that is adopted, and I can say that we really expect this adoption quite shortly, within the next few weeks, then you will read and see all that. And in our application portal, all this will be very clear. And as a last slide from my side, I wanted to remind us all, if I may get my last slide, that in our underlying legislation, we do have provisions on what is called affordable access. So any product and service that we develop through clinical research that we fund, at the end of the project needs to be affordable, available, and accessible to the public at what is legally called fair and reasonable conditions. And in order to put this legal obligation into practice, when we do a grant with project consortia, we require them to have what we call deliverables. So they need to produce something for us, and they also need to go about using the results and outcomes of the project that is called exploitation. And there you will have certain obligations that will be defined in your grant. And that concludes my little presentation here. I look forward to answering potential questions at the end of the program in the question and answer session that Tom had already announced at the start. Thank you very much. And over back to Tom. Thank you.
Thanks very much, Elma. And dear participants, that was Dr. Emma Nimsingheim, Interim Director of the Global Health EDCTP3 program. And I'm sure you may have a lot of questions, but reserve them towards the end. As you have seen in the program, we have reserved almost an hour on the questions and answers session, because this is very important for us to get the message across, but also to get your message across to us. In his presentation, Elma mentioned the eligibility criteria of an entity being eligible if it is in a country in sub-Saharan Africa, which is a member of the EDCTP Association. So next, I'll call upon my colleague, Michelle Singh, who is a project officer, but also responsible for liaising with African member states in this exercise of securing their seat on their EDCTP association. So Michelle, please take it away to help us understand this issue of EDCTP association and how to join. Over to you.
Thank you very much. Good afternoon.
Sorry, Michelle, I think we are having difficulty to hear what you're saying.
And now, is it any better?
Yes, I think that's better than before.
Okay, we've just had load shedding. We're currently in the middle of load shedding. Can we have the next slide, please? Okay, so this schema gives a very nice comprehensive overview of the Global Health EDCTP3 governance structure. And what is very important to note here is that the EDCTP Association is one of the two founding members of the Global Health EDCTP3 joint undertaking, and it represents its European and sub-Saharan African member states in the governing board. Can I have the next slide, please? The association has two offices located in the Netherlands as well as Cape Town, South Africa. Independently, they oversee matters related to governance of the Global Health EDCTP3 joint undertaking, and also provides technical support, especially in terms of capacity development, as well as jointly. Both offices play a very pivotal role in overseeing relationship management with the European and African member states. Next slide, please. There are three categories of membership based on the program participation. And this depends on whether members would participate just in EDCTP2 only, category 1, whether they'll participate in the joint undertaking, that will be category 2, as well as the last one, which is participation in both programs. Next slide, please. As of yesterday, we are very delighted to welcome now 24 African member countries, and yesterday we concluded the General Assembly vote, which then admitted Liberia, Malawi, and Zimbabwe to the association. We also have 15 European countries who are part of the EDCTP Association. We have also recently, since the beginning of this year, received expressions of interest from Madagascar, as well as Sierra Leone, and also Angola. In terms of obligations, to join the EDCTP Association, there is a requirement to submit formal commitment letters, and these must be signed, and we will share the templates for all member states who might be interested in starting this process with EDCTP. Membership also involves annual cash contributions, as well as administrative expenditure costs, and these are calculated based on 40% of the fixed contributions and are paid equally by all members, as well as 60%, which is calculated based on a member state's particular GDP. African member states will cover 10%, and the European members will cover 90% of these contributions. We also have the in-kind additional activities, and these are funded and managed by the participating member states independently or jointly, and they conduct work or activities that actually align with the objectives of the Global Health Joint Undertaking. Next slide, please. So in conclusion, I'd just like to say that if you take one message away from this presentation today, it is this. Please remember that all countries may join the EDCTP Association at any time. However, for legal entities to be eligible for funding under the open calls for proposals, which you will shortly be seeing, these respective countries must be a member of the EDCTP Association by the time of grant signature. Next slide, please. If you have questions or would like to start the process of joining the EDCTP Association, you're very welcome to contact myself or my colleague who is based in the Netherlands, Lara Pandya, for more information. Thank you very much. I would like to hand you over back to Tom. Thank you.
Thanks very much, Michelle, and thanks for sharing your contact details, because that's very important for our partners in everywhere where they are, to know who you are if they have a question on member states and joining of the association. And we do encourage previous research grants recipients, current research grants recipients, and interested scientists to talk with their ministries of health or ministries of science or ministries of research in their countries, or maybe, let me say, responsible authorities for countries that are not part of the association, to discuss within the countries and help to create an understanding of why it is important to join the EDCTP Association from the beneficiary side point of view, as well as what are the benefits on the policy side of the equation. So Michelle is a key person that can provide such information to participants on this call that are interested to learn more about how to stimulate their countries to join, especially for those that have not joined yet. But I would like also to add with this slide that beyond supporting member states, we also, from the Africa office, we provide support in the ecosystem to different partners that are key for EDCTP to be a successful program in sub-Saharan Africa. And first, I would like to mention the collaboration we have with the African policy and public agencies, and I've listed them there. Africa CDC is key to EDCTP's function, as well as AUDA NEPAD, WHO Afro, and all the relevant regional economic communities within the confines of sub-Saharan Africa. So from the Africa office, what we do, because we know these policy making bodies represent you, we have memoranda of understanding with most of these. And within them, they are embedded the working principles that we feel will be of benefit. But it will also be nice to have a look from your user's point of view in these kind of relationships we have, and let us know what needs to be considered. But all in all, if you want to have your work aligned with Africa CDC or AUDA NEPAD, we have different programs through which we engage, and we will support scientists, sites, and their institutions to meet criteria that will make them work in a way that we also fulfill what our regional bodies are there for in terms of interventions against the diseases that are a menace to all of us. At the second level, we have collaborations with networks, and some of these networks, like those listed there, the three of them, are EDCTP originated networks that were conceptualized and started funding with EDCTP ideas, of course, with a lot of participants here on the list. Some of you, provided ideas on how Africa can become an equal partner in the partnership with European countries. Well, we start from a point of view where we have very little capacity, we are all over the place, we are not really coordinated as one region, and we have very few scientists that are full-time equivalent in research and how we can develop more, etc., etc. From that level, we also collaborate and support the needs of funders, PDPs, industry, and CRO coming to work in Africa. Quite a number of industry and other funders who are not conversant with the African terrain, they stay aloof because they don't know what is in the continent. And this is where we step in as the Africa office to highlight the capacities and the potential levels of engagement that African sites have, and that can be used as a leverage into the joint investments in clinical research against infectious diseases. So, for example, the Africa office works with the Africa Academy of Science and Science for Africa Foundation in providing visibility of the potential capacities African sites have through the clinical trial community database. That's just an example, but we do have other engagements with a lot of other partners that we have on there. Michelle already talked about engagement with our association members. The figure there is wrong because Michelle pointed to us that Malawi, Liberia, and Zimbabwe were approved as members of the association. So that's why the figure has gone up to 24 members. But would like more and more members to come on board. So that's the key message, that this office, the Africa office, is your office for liaison, planning, communication, coordination that you need to consolidate the EDCTP3 program in Africa. So do contact us. I've put the contact details of the colleagues there that are mainly engaged in these activities. And if they are not, or they cannot answer your question, they will ably refer it to someone else. So let me stop there and call upon my colleague, Jean-Marie Habarugira, who is going to talk to us about now the Global Health EDCTP3 2023 work program, which is what Irma alluded to earlier on, that once it's approved in the next few weeks, will be a source of the calls for proposals that EDCTP3 will launch in 2023. Over to you, Jean-Marie.
Thank you, Tom. Thank you, everyone, for joining, attending, listening. Most of you already know me from the previous program. I'm known as Jean-Marie. I recently started working with this third program.
Sorry, Jean-Marie, to stop you a bit. I think there's another mic that is on, so there's an echo. If we can just mute it first so that you come crispy clear.
All right.
Yeah.
Yeah.
There's still a bit of an echo, but you make, in the interest of time, you can carry on.
All right. So I'm going today to talk about the draft topics that belong to the work program 2023. This is a program which is being finalized, but those who have had a chance to visit our website, not the EDCTP2 website, but the Global Health EDCTP3 website, which is hosted by the European Commission. Let me just check if there is an echo from some device here. I cannot see what device is causing an echo. Maybe it is an issue that I cannot see right now, but hopefully you can follow. If not, if it's a serious issue hearing me, let me know in the chat. I'll just quickly go through these slides. But when we come to the Q&A session, hopefully this echo issue will be solved. I was mentioning that if you have had a chance to visit our website this morning, we've published a draft set of topics that belong to this 2023 plan. This is still in a draft. This is still in a draft version because the governing board still has to adopt it. Now, the main message of today is on this slide. I will take a few minutes just to not to read each word, but to mention the kind of calls we are going to be launching soon. It's a total of 7 calls, topics as we call them. They're still drafts. As you can see, we've displayed the amount of money available. And as if you are used to the types of call we launch, it's always it's divided between single stage and 2 stages. We do have 5 topics which will be launched in a single stage, and 2 will go in 2 stages. First, I'll just mention that first line, which is going to be known in the future as Global Health EDCTP3 Training Networks. If you see what is in the brackets, it's RIA, what is known as Research and Innovation Action, meaning that these fellowships will be actually integrated in research projects. If you know, traditionally EDCTP 1 and 2 have had what we used to call TMAs. Those were training mobility awards or training through coordination support actions. But these are networks which will be doing research and looking at the amount of money, 15 million euros, that is meant to accommodate a lot of fellowships via these networks. The second is going to be supporting a number of clinical trials which were funded by EDCTP2, but because of COVID-19, run out of cash, run out of budget to successfully finalize the program. These 14 million made available for those projects. So there is a number of studies that we'll be seeing in the next few weeks when we publish the final version of the call. Then the third is about looking at women and children health. It's 14 million, looking at a whole range of interventions that aim to improve health conditions in this category of special population. Then there is a fourth call, which is looking at interventions on Ebola outbreaks. If you look back in the history of EDCTP2, there have been 2 times that calls on Ebola were launched, but budget-wise, those were limited. Also, in terms of scope, they were not exploring a lot of interventions. But this 11 million is meant to build on those studies supported back then, but also looking at new ideas, new interventions being developed to see if they can move through the pipeline. That will be also a single stage. And then the fifth category is something traditionally that has become traditionally something that EDCTP looks at as an essential part of capacity building in terms of research in South Africa. This is to strengthen ethics and regulatory capacities, entities, institutions, or agencies looking at study protocols or looking at new products coming to the market. This also comparing to the past. The budget is quite substantive, so hopefully this year we can cover some of the countries that have not yet managed to get strengthening through these calls in the past. And then we do have a sixth topic, which if you look at the figures there, it's maybe the most expensive one, the largest in budget, in terms of budget. It's not surprising because this we're looking at vaccines, delivery, deployment, and uptake of vaccines through phase 4 implementation research. And then the last topic is advancing point of care diagnostics to the market. Next slide. Then there is this concept of scientific project leadership, which you have the opportunity to read extensively in these texts that we'll be publishing. So this to ensure that all partners in the funded consortia, including those in sub-Saharan African countries where maybe because of the new law we are operating under cannot function as coordinator of the project, our governing board is discussing a new approach that will establish a function of scientific project leader within each consortium. So this is to say that if the coordinator is not established in some of those countries that we will not accept to have as coordinator, financial coordinator in the project, this will become, the designation of such leader will become mandatory in the consortium. Next slide. Here we've tried to list the key functions, the key tasks of this project scientific leader. It will basically be what would be a combination of the first scientific coordinator, the scientific coordinator in the past, what we were looking at the main contact person, the main contact scientist in the project. Those tasks will be going to the scientific project leader, whilst the financial management of the overall project will remain the task of the coordinator. Next slide. Those were the words we have to share today in terms of the calls available this year. But again, just to insist that we still have them displayed on our website as draft. As soon as this is final, you will have the opportunity to read the timelines, but also any other change that may take place in the coming days. But also, as you'll see there will be a second info day planned on the 12th of April. On that day, we hope to have much more details than we are able to share right now. Thank you. Back to you, Tom.
Thank you very much, Jean-Marie. And I apologize to all the participants because there was an interference there when Jean-Marie was talking. But we all have an opportunity to compose your questions during the time of questions and answers so that we can address them. The apologies for that interference, which we could not fix. Yeah, but I think the message from Jean-Marie was quite clear, and you have seen for yourselves from what he presented that there is quite a lot of leverage that, and coverage in terms of the planned activities, in terms of calls for proposals for 2023. And it should be a very exciting moment for a lot of scientists working in these fields. And we wish you all the best when the time comes that the calls are opened. And also committing our office. If there will be any other need for follow-up, we will be open to answer your questions. Now, I'll open the biggest part of our program, which will take us up to an hour from now or so, and that's the questions and answers. So we have on our side the last presenter, Jean-Marie, who will answer most of the technical questions, but we also, if there's any other panelists who feel like they have the better answer to whatever you'll be asking us, they would be able to take that up. And then we have Elma, and then from our legal team, we have Laurent, I think he's online from Brussels, and Michelle Singh also. So we have here key questions. So one is from Anonymous. Sorry if I missed the information, but can the UK join a consortium as a coordinator or just as a partner, as third party? I'll throw this to Elma if you're online, still online. I'm sure you are.
Yeah, thanks. So we actually did not talk about this, and in a formal sense, I will have to say that the situation may actually change during the year. But what I can certainly tell you is how it worked last year. So UK legal entities, at grant signature currently cannot be coordinators. But at the proposal stage, you certainly can apply with UK legal entities as a coordinator. And we then will have to see during grant preparation how the association process of the country to Horizon Europe progresses. You may have heard that the Windsor Agreement was approved by the UK Parliament yesterday. And from what I've heard, that was one of the bases for now, moving quickly forward on the association discussions of the country to Horizon Europe. We also have heard that there is some questions about the association of the country to the program, even with the Windsor Agreement there. So it's really quite open on a political level, but we are quite hopeful, let's say, that this will come to pass. And then the UK would, of course, be treated like an EU member state, and the country is already associated now. But the way it works is that we postpone that decision really until grant signature, which will not happen until probably at the earliest December this year, and most likely even January, February next year. So we still have quite some time for these political issues to be resolved until a final decision will have to be made. And if there is a change to be made during grant preparation, we can do that. And this is actually what we did last year. Over.
Thank you, Elma. If there are any follow-up questions, pass it on to participants to post that in the slide. And the next one is, are there any Swiss entities that are already part of the partnership? I think that goes to either you, Elma, again, or Laurent.
Well, I can quickly mention that indeed we do have Swiss legal entities in the project that we are currently preparing grants, so that were submitted to the 2022 calls. Those are not eligible for funding, so they will have to get funding from Swiss sources. The country has had these kind of arrangements. I honestly have not checked currently, but I would assume that similar type of arrangements would continue to apply. But since this is not, in our control, we cannot guarantee it. But of course, with legal entities on top of the 3 minimum required for eligibility for funding can be part of consortia. They are not eligible for funding. Over.
Thank you. Thank you. I think there was a quick question about sharing the presentation. So we will see what we can do about that and how we can share the presentation. There might be a portal somewhere after the session. When will the EDCTP3 funding open? Jean-Marie, it was contained in your presentation. Do you want to take that one?
Yeah, I can briefly say that right now the board is busy approving the draft topics. So it's a matter of weeks, not a lot of weeks. I think I'm not able to name a date, but it will be pretty soon. So just the most important information is that the draft call topics are on the website. So you can actually now start reading, seeing the topics and putting together your consortia. And the real opening date, they are going to be two. If you are used to the way EDCTP2 opens a call, this case will be a bit different. We are going to first to announce and then open the portal for you to be able to enter your proposals in the EC portal, in the European Commission portal. So these 2 days there'll be a difference of maybe, not sure, maybe a month. So there'll be first time to read and go through the text, and then actual opening of the portal.
Thanks, Jean-Marie, for that explanation. And next we have the slide showing, I think we have already dealt with that, the eligibility of UK. We can go to the next one. Yes. What is the difference between the coordinator and scientific leadership of a project?
Yeah, so maybe I can continue to speak about that one. It is already described in the draft text again, but in a few words, the coordinator will be the primary liaison between the consortium and the funder. And the coordinator, another important function of that coordinator, if we talk about an institution, not an individual, that coordinating institution will be receiving the funding from the Global Health EDCTP3. And the primary role when that funding comes will be to distribute to other beneficiaries. And the grant agreement, which gets also signed, it's concluded between the coordinator and the Global Health EDCTP3. The other beneficiaries agree to the text, which has been co-signed by the two parties. So that is the most important role of the coordinator, to lead the contractual obligations of the consortium towards EDCTP. And then the scientific leadership in the project is going really to look at the scientific content. If it is, for example, a consortium running a clinical trial, issues related to monitoring, issues related to acquiring approvals in each country where participants are going to be recruited, issues related to maximizing impact of results from the project. That is going to be the scientific leader's role. It is also mentioned in our draft text that scientific leadership needs to be included as a work package in the proposal, not only as work package, but also budget needs to be made available for that function, because it is not going to be just another second or lieutenant function to the coordinator. It is really going to take care of a lot of things which are mentioned in the project in terms of getting scientific value out of the project. So it is, some are already using simple terms like coordinator takes care of the finances and scientific leader takes care of the science. But it is, if I may extend on this, this is also something which is coming to fill the gap where we see that scientific ownership of the projects sometimes goes to stronger institutions. And in this case, if you look at how the new law is looking at things, a lot of coordinators, those eligible to be coordinators, will be in the Global North, plus South Africa, if you look at other members of the EDCTP association. So if we're looking at keeping the momentum to let those who are ready to own the science, to own the research, whatever they are based, either in this consortia, to own the research through this function of scientific leadership. So the expectation is also that those who will be producing the science, those who will be on the ground doing the research, are also going to be taking this role of scientific leader. But that is not a decision that we, the fund, are going to impose to the consortia. It is a decision within you, the consortia, looking at a proposal being put together to agree on who is the right country, the right place, the right institution to lead scientifically the project. And it's always, even before this term came to life, there was in practice a member of a consortium who was playing this role. The only difference is that we're not using this as an official term. And actually, if I look at things in a positive way, this time around, we are going to be able to put a budget to this role, also to make it a concrete work package. So we are also mitigating a few consortium management issues that used to happen in the past, where maybe this function was not written somewhere and was probably pushed towards X recruitment site without necessarily giving them the means and the power that you get when you probably are mentioned in the proposal as leading a specific work package. So I'm looking at this as a tool to increase ownership by those doing the real work when it comes to running these complex clinical studies.
Thanks, Jean-Marie, for that clarification. And maybe that also goes back to the issue of changing the landscape or the paradigm and people doing due diligence to the legal matters of consortium agreements, not the way we used to know them. So thanks for that clarification. I think if there are any follow-up issues, we'll see them in the chat. And the next one is maybe related to that, Jean-Marie. Can you clarify which sub-Saharan African countries can be coordinator of EDCTP3 project currently?
Yes. So as of today, we have only South Africa, because South Africa has signed a sunset technology agreement with the European Union. They can be coordinator in a project, but a lot of other countries can be then the scientific leaders. But as of today, and I think we are not expecting any other country to sign that agreement in the coming weeks or months. Maybe in the future there will be other countries joining, but only South Africa in Sub-Saharan Africa is able to fulfill that coordinator role.
Thanks, Jean-Marie. So in essence, when you say South Africa, it means that also applies to the South African institutions, basically. That's what it means. They have that mandate can be filled legally. Okay, so let's go to this one. Interesting. What are the requirements for Swiss industry and academia to join this core, besides from the fact that they cannot obtain funding from the partnership itself? Laurent, are you able to, or Irma? Yeah.
Well, I think I can very quickly reply. I mean, it's like it's a normal formation of a scientific consortium, so there's no particular conditions. I mean, a legal entity from Switzerland does not count towards a minimum number, but as I clearly explained, once the minimum number of legal entities is achieved, you can have Swiss partners just like you can have partners from other countries, but there's no particular requirement or process that I could think of. Thank you. Over.
Thank you, Emma. We'll probably come back to that if the participants are not satisfied, but I think that was satisfactory. Yes, will EDCTP fund fellowships? Jean-Marie, it was on your slide.
Yes, that was the very first line in that table of draft topics. So what I'm sure people in the audience are used to the traditional training and mobility awards in EDCTP 1 and 2. So what we used to call career development fellowship, senior fellowship, or industry fellowship, we've taken a lot of lessons from that, and now we've designed what we are going to be calling the training networks. These training networks are going to, you can roughly call them fellowships, but we are not using fellowships because these will be research and innovation actions, real clinical studies that will then recruit students. Without getting into much details of what you'll be able to read in the final call text when this is approved. What I have to say, again, looking at things from a positive point of view. This is going to allow candidate fellows from countries that would not otherwise be getting access to these training, because it's a network. So the network will get a grant from EDCTP3, and from there fellows will be recruited, and it's covering a lot of issues that we learned as lessons from the previous program. So yes, if the question is about fellowships, yes, but it will be through these networks.
Thank you, Jean-Marie. I think that's a very important point to emphasize, that for people used to the way fellowships were funded previously, this time it has to be them having consortiums of training that will train the networks within. And I think the Africa office has had a lot of experience on that, because many of the fellows were previously supported from the Africa office, but now we have changed that. We have also a lot of our colleagues in The Hague that are managing these projects, but the emphasis of that funding was the institution and the person. So, but now it will be the networks. Then those networks will have to train the fellows within them. Currently, we have such a setup with the Africa CDC, where 10 consortiums are training 150 statisticians and epidemiologists, but the funding goes directly to the consortiums. It doesn't go to the trainees, so to say. I think that is the major clarification that Jean-Marie was trying to make there. I just wanted to supplement with that. Now, the next one is, when will the course be launched? I think we have already, Jean-Marie has already tackled that. We can go to the next one. Yes. Could you please clarify if international organizations such as WHO can join a consortium and is eligible for funding?
Was that Laurent or for me?
I'll defer that to my colleagues, either from the legal side or operations there, Jean-Marie, Elma, and Laurent.
Yes, thank you for giving me the floor. So that's a good question. So indeed, such organizations can participate in the projects like any other participant. However, in principle, international organizations are supposed to come with their own funding. There are a few exceptions under certain conditions, but the general principle is as such. So if WHO wants to join, for example, a consortium, it's possible, but they have to provide their own funding. Over to you.
Thank you, Laurent. I don't know. Yes. When do you expect the 2023 work program to be approved by the board? Jean-Marie mentioned that it will be just a matter of weeks, and very soon you will see some action on the website which relates to that, isn't it, Jean-Marie?
Yes, as I was mentioning, I think the most important is what is already published since this morning. It's almost a 40-page document. What you will see, we are calling them draft topics, but it's really the most important thing you need to know before the official document comes as the approved work plan. There may be slight changes to this final text, but what you would like to know is already contained in document published this morning. So there you can see the types of diseases that will fall in the scope of a call, or which ones are excluded from a call. You'll be able to see the duration it's drafted. You'll be able to see what we are trying to put as expected duration or expected impact from the projects. So all the real call text content, although now it's still marked draft, but if you'd like to get to know what will be approved, what the board is reviewing, it is the draft which is now on the website.
Great. Thanks, Jean-Marie. So basically, it's work in progress. The next one is, will South Africa remain the sole sub-Saharan African country that can financially coordinate a project? Yeah, so again, I think Jean-Marie explained that currently we only have South Africa with the Science and Technology Agreement with the EU, and that gives South Africa the legal responsibility to be a coordinator. But if other countries come up with such agreements, which he said, rightly said, because this is bilateral discussions, they don't happen in weeks, months, some take years or decades, depending on what is going on, the discussions going on in different countries to agree, then yeah, South Africa may be the only country for quite a long time, unless we have other countries coming on board very quickly. So do you have any comments, Jean-Marie, on that?
Yeah, so South Africa for the time being looks like the only country in Sub-Saharan Africa with that agreement with the EU. Maybe there are some that are in negotiation. I wouldn't be able to know that. But again, I'm using this to reiterate, to repeat that it is the function of coordinator. What the opportunity here that we're taking is to give prominence to this new concept. I'm looking at this as a new term is born, a new function is born, that of scientific project leader. We are using GCP to talk about clinical trial sponsors or monitors, but in this case, scientific project leader, to me, for those countries that maybe cannot even dream of signing this agreement with the European Union in the coming years, this should be the focus to also when we are going to be looking at the performance indicators. I'm sure many will be looking at which countries did well in taking care of projects as scientific project leader, which institutions. So the term coordinator, of course, has been there for many years and it's used by a lot of funders. But in our case, we are putting a new parallel function, which is, to my view, also as important as that of that. The coordinator will be signing the agreement with the funder. Having said that, I have to say these are things beyond our institution. We do not know which country right now is negotiating such an agreement with the European Union. If there are some, that would be wonderful, but for the time being, it's just South Africa.
Thanks, Jean-Marie. So we go to the next one. Italy, as well as the other EU countries, are not yet in the Global Health EDCTP3. What does it mean in terms of participation? Does Italy apply as a coordinator or a beneficiary?
Right, maybe quickly before Laura can clarify, I don't know, it's a member state of the European Union, so that's that gives them a different status. Laura, maybe you can add.
Thank you, Jean-Marie. So yeah, indeed, I can confirm what you just said. The fact that Italy is not involved in the EDCTP association, that's how I understand the question. And they are not part of the JU, of course, directly, but they're not involved yet, maybe fully at least, in the association. But this doesn't change anything for EU member states, indeed. So they can participate as beneficiaries, be funded by the JU, and also act as a coordinator, and of course be counted as one of the EU countries part of the consortium, which is necessary for the composition. So Italy is in fact fully in. Over to you.
Thank you, Laura. I think that's a very important clarification. I think that coordination mainly is affecting sub-Saharan African countries, but not EU countries per se. And the same with participation. The next one is, what are the expected dates of submission? I think that one is already captured. Oh, sorry.
No,
it's a submission if that question could come up again, because that was talking about a two-stage call.
Yeah, I think I read it. It was about the deadlines for the submission of the two-stage call. Again, that is something which is part of the document that is not yet approved. Once the work plan, the work program is adopted by the board, we'll be able to share the deadlines. Right now, we cannot confirm the opening date, the closing date. This concerns both the single and the two stages call, but this will be clear soon.
Thank you, Jean-Marie. Then there's another great question. How can I find partners to create a consortium to apply for the call?
Great question.
I'm not sure whether that's from Europe or Africa, but generally, what would be your advice?
Yeah, my advice to this question, many years ago, I also used to have these questions, and I looked at funders. There are funders who proactively help potential applicants to look for partners. But in this case, we at EDCTP, what we encourage is people to look at the content of the call. For example, if there is right now a call on Ebola interventions, we do know which countries tend to be prone to Ebola. So it is based on the science in the calls that you look for partners, but also the composition. The first thing, you have to be eligible. So the slide in the beginning displayed by Elmar, where you have these mandatory members that you have to have in the consortium to be eligible. So how do you find those partners? Of course, if you are applying from Senegal and you have to be eligible, you need to think about that EU-based member. You also have to think about maybe other members in Southern Africa. It is first your own initiatives, but the most important thing that maybe I can share here as Global Health EDCTP3 is that on the funding and tenders portal of the European Commission, there is a function to search for a partner. So that is, we cannot guide you, so you can use that tool to find partners based on what you want those partners to implement in the project. But that is, I was just mentioning that some funders have a proactive way of helping the potential applicants. So this is positive news that Global Health EDCTP3, as opposed to what we were doing in the past 20 years, there's this fantastic tool where you can search for potential co-applicants. But how you use it, it's up to you based on the needs.
Thank you, Jean-Marie. I think that's a very important question from the African point of view. That could be a question be asked by many countries that we classify as countries left behind. I think there are institutions or scientists that feel very isolated. They don't belong to any network. But as you know, diseases teach us that those are the gaps where we need to go, because epidemics can start from those corners, which are completely neglected and people don't go there to network. That's a very important question. What I would also add is that looking at events like conferences that other organizations do is a great way of meeting people who you can network with and have great ideas. Once you listen to what they're presenting and what they're doing, you can also interest them yourself in what position you think you can take within their consortiums. And EDCTP has a forum every 2 years, and as you have seen on the EDCTP website, this year's forum will take place in Paris, in France, and has already been advertised in the first week of November. So that's another way we encourage. As Jean-Marie said, we used also in EDCTP2, not what EDCTP3 has created as a partner search. We used to have it on the website, but over time it becomes an underutilized tool. And it's not surprising, because scientific alliances are based on different way of trust that is built over time with people and interest. But I do also get the point that if we don't have a deliberate organic growing of these networks, diseases teach us very bad lessons. That's why I find this question really, really interesting. We
So
can be, yeah.
Maybe Tom,
Anybody
if I
else?
can add something here. It's good you mentioned the categories of countries that are likely to be looking at this tool to find partners. There's a specific call in that table I displayed about point of care diagnostic tools. I have to say that is a specific call where I see that almost each consortium needs an industry partner for manufacturing, for upscaling, those kind of topics. If you use that partner search function on our portal, you can also narrow your search to specific categories of entities. You can search academia, industry, but you can also look into specific intervention, diagnostics versus drugs versus vaccines. So I'm looking at that tool as something which is also very useful for some of these very specific research targeting less known diseases, where actually the tools, especially point of care diagnostics, are still scarce. But somewhere on the planet, not necessarily in the European Union, somewhere on the planet you have other less known SMEs maybe working on the same types of interventions. So that how it works, it is a two-way. Those kind of less known SMEs, for example, they input the information in this tool. So what you find in that tool depends on what people have inputted. So if I have a business and I want to do business with you, I put my information there to be found. So here it's also to encourage those who want to be found as partners in projects. They can also actually send the data through that portal. I'm not going to explain the details on how it works, but just to mention that you can also go there to be found, not only to be looking for partners.
Thanks, Jean-Marie. Points well made. Although the challenges still remain that we still need to break these language, geographical barriers, and things like those that prevent us from doing meaningful science. Thanks for that. The next question is the call only for clinical trials, or can it fund qualitative, quantitative research, healthcare delivery? Are NGOs eligible to apply?
So that is the first part of this question. They are not only clinical trials. Where you saw, if we put in brackets, REAT is research and innovation action. Those are projects that will involve a clinical study. But there are also some other projects which are commonly known as coordination and support actions. There you have, for example, that call which is going to support ethics and the regulatory capacity in sub-Saharan African countries. You have also a call which is looking at phase 4 implementation research, focusing on optimizing or uptake of interventions that have already been investigated. So that is not necessarily going to involve a clinical trial, but can also just focus on the policy part at the later stage of implementation. So it's not only clinical trials, but you have to look at those 7 topics. You'll see clearly which one have to have a trial component or not. And then NGOs are eligible. Yes, NGOs can apply as any other entity. What happens, you have to be a really registered entity that can prove to the legal service of the European Commission that you are actually a well-known entity in the country where you are established. There could be the world of NGOs includes different categories of NGOs. Some of them are maybe newborn based on a specific need in the region. Others are well established, but they are seen as the term NGO where we work, we just call it non-profit. So the funded pool is made of profit and non-profit, so it is they're eligible to apply.
Thanks, Jean-Marie. And those healthcare qualitative, I guess some of these issues can also be part and parcel embedded in a clinical trial, because a clinical trial is not just like your bench science or in vitro, in vivo studies, but involves human behavior, all these things embedded in a clinical trial. So some of these issues can also be embedded in the consortia that are responding to the calls. That's just an additional comment. Laurent, do you have something to add?
Thank you. No, I was already anticipating the next question. So
right. Okay. Can an African country receive project funds directly, or do the funds have to come via European country? Please.
Yeah, so on this question, so quite simply, the funds are in fact always channeled through the coordinator. This is a condition we have to respect because we were using a model grant agreement in which this is foreseen. So always through the coordinator. So they're like beneficiaries wherever they are from. In principle, don't receive funds directly. And as you have heard earlier, the coordinator can only be, in principle, so an EU associated country or, in practice, South Africa for the time being. So these are the countries where the coordinators can be and that receive the funding, which is then later transferred to each beneficiary. So I hope this replied to your question. Over to you.
Thank you, Laurent. Can you elaborate on the aspect of in-kind additional activities that was mentioned in the presentation? How does this work? Maybe
can you hear me, Tom?
Yes. Yes.
Okay. So these, I'll start and others can join if they'd like. These are in-kind additional activities. These particular activities are another way in which member states where their contribution may be counted. These activities are actually funded and managed by the member states themselves. And they can be done independently or they can be done in conjunction with other member states. And that is actually encouraged as part of the program. And also what's very important is these activities must fall within the scope of the work and also the objectives that are being undertaken by the joint undertaking. So some examples include, for example, the hosting of researchers, the hosting of fellows in between institutions and countries, as well as sharing of laboratory equipment, and so mentoring, supervision, sharing of equipment, infrastructure. Those are just some examples. And we encourage the members to take note of their in-kind activities as these are captured on an annual basis. Thank you. Tom.
Thank you, Michelle. And I think the point to emphasize is that the way we know European countries and African countries in global health, many of these countries are already doing or funding within their countries what we call in-kind contributions, because they are EDCTP aligned activities. So if you come to your country and you are already putting some money in some vaccine work, as Michelle says, you're training health workers, capacitating them in clinical research activities, all these can be built into what we call in-kind contribution. So once you are a member state, you'll join the membership and we ask you, how much have you been spending on EDCTP? It's easy. You just collect those activities because they are EDCTP relevant as something that you do on an annual basis and account them as in-kind contribution. And some countries spend a lot of cash, of course, like, there are quite a number of examples, but not all of them do actually directly put direct cash into clinical research, but money comes in indirectly through use of facilities, hospitals, nurses, doctors, and other things that we account for, which I think is a good system to leverage on in terms of our efforts. Yes. So the next one is, can the industry and CROs take part in the various consortia for joint application as service providers to the consortia or as partners?
Yeah, maybe quickly, it is the industry and also any other for-profit partners can be members of the consortium, so beneficiaries, but they can, depending on what the needs are in the project, they can be also invited by the consortia to provide services that would be then they would be subcontracted to provide specific services. So both apply depending on the nature of the project. An industry partner can join the project as a beneficiary. They can even coordinate depending on the country where they are based. So they are not in the spirit of innovation. Actually, these kind of entities are treated equally as any other potential applicant. It's not, we are not focusing on academia only, for example. It's any science generating entity can apply or can be invited to provide services.
Thanks, Jean-Marie. So just to clarify, what you mean is that CROs or industry can choose to be part of consortia either as collaborators or service providers, in which case they have to be, it has to be clear in the application that they are contractors. But both are allowed. Thanks very much.
Yes.
Okay. Great. So can you please confirm that the course will be launched before the next Info Day in April, on April 12th? Will the next Info Day differ from today's Info Day?
Emma,
go ahead.
I can come in. It really depends on whether we make it for the approval. In any case, we will, emphasize maybe some other points. I mean, generally speaking, I mean, the substance of the information, of course, at the second Info Day can only be the same as what we are telling you today. I mean, it's not like we have a different program to talk about. So generally speaking, I think the information will be quite similar, depending on whether we manage to get the approval in time ahead of the next Info Day, which we do not know. It is certainly possible, but we just cannot confirm something that is in the future and that is beyond our control. I hope you understand that. We fully appreciate your eagerness to get this information and the details as soon as possible. We are fully conscious of that, but there's just, there are certain processes that have to be followed. And I hope for your understanding that colleagues, and neither can I, nor Jean-Marie, nor Tom, or anybody else can give you firm answers on these kind of questions. But certainly we look forward to have some of you join us again in about, 3.5 weeks or so. Thank you.
Thanks, Elma. And then the next question is, when will you publish the list of successful projects in 2022 calls?
I can also quickly answer this one, if I may. So those who are familiar with our EU granting system, once grants are signed and everything is ready, the projects information becomes available on the Cordis portal, which is the centralized portal for all grants funded under Horizon Europe and Horizon 2020, by the way. So you should start seeing grants actually coming up once we have, perhaps not the very last one, but once we have a sizable number of grants signed. We will also publish like aggregated information and will also publish, like information about the projects that we were able to select from last year's calls. We don't want to just have a note with like 3 grants signed. We probably wait until we have maybe a dozen or so that we have a little bit of more substance and a bit more of a portfolio to talk about. Thank you, and over.
Thank you, Emma. And next is a question about associated partners. Are associated partners allowed to be coordinator of projects? Laurent?
Thank you. So no, the answer is quite simple. No. In fact, coordinators are always beneficiaries of the grant agreement, which means that they also sign the grant agreement. An associated partner, to the contrary, is a third party. They are associated to the project through the consortium or through a beneficiary, but they do not sign the grant agreement with the joint undertaking. So clearly they cannot be coordinators. Over to you.
Thank you. And are there only 7 calls for proposals in 2023?
So yes, there are just 7 topics. As I mentioned, there will be 5 single stage and 2 which will be in 2 stages. But one important thing, Tom, that I should mention here is this 2023 work program has a provision for what we traditionally call the emergency funding mechanism. But this is something which gets activated if there is a declaration of a public health emergency, if there was to be a major outbreak in sub-Saharan Africa, for example, that mechanism would be activated by our board and the involved parties in the governance. That is, we are not calling it a call for proposals, but it is something which definitely goes out as calling for research to apply to it.
Thank you, Jean-Marie. So the answer is, in case of emergency, it can't be 7. There will be, more response than that. Thanks a lot. And I think also the importance of this year's calls, once they get launched, is the one you mentioned about support for projects that were heavily affected by the COVID pandemic. I think that is a very important call as well. The next question is, are current grantees of EDCTP2 with outgoing projects eligible to apply for EDCTP3?
Yes, they are not excluded because they have ongoing research. It is, in fact, we encourage people to researchers to build on what has been on investments made by the previous programs. Having said that, it is there should be, of course, there should not be duplication of what is already funded. So this is a clear question. You are not excluded because you have an ongoing EDCTP2 project, but it has to be different, preferably building on results obtained from the previous, or maybe, as Tom was mentioning, if you belong to this particular group of projects that have been classified as severely affected by COVID-19 and cannot complete successfully the implementation, there you are encouraged to apply. But any other grant holder of EDCTP2 is eligible to apply.
Thanks, Jean-Marie, for that clarification. And the next one from Anonymous is, to what extent will Global Health EDCTP joint undertaking work to prevent and tackle pandemics like COVID? Is this under its scope of work? Elma, over to you.
Yes, thank you, Tom. So clearly, this is within the scope of our work. Of course, it's a bit difficult for me to answer concretely how we will do this, to really answer the question more precisely. It will be done through the project that we are funding and that we will be selecting. So, if I go back to the 2022 call, we had, for example, a topic on genomic epidemiology, and I would expect that some of the grants supported under this project will really help uncover the genomic makeup of pathogens throughout the sub-Saharan African region. And I would assume that that actually will be quite an important factor in helping us prepare for pandemics. and to some extent then also to prevent them. So it will be through specific topics. This year, the topic, as Jean-Marie had presented, that actually addresses this kind of preparedness research, perhaps closest would be the one on the Ebola, fighting the Ebola outbreak with rapid responses beyond vaccines, which are excluded in that particular topic, as you will see in the draft topic description. Thank you, and over.
Thank you, and the next question from a colleague from HepsaNet, I think it's Anne Fox. Thanks for the question. Viral hepatitis does not seem to be included in the diseases included in the project. Can you please explain, given the burden of disease morbidity in Africa? I'll put you on the spot again, Elma, for that.
Yeah. Now, the focus of the strategic research and innovation agenda is as it is defined, and I cannot give you really a very good reason why certain, I mean, generally speaking, it is the neglected infectious diseases and the diseases with particular high burden in sub-Saharan Africa that are included. I cannot respond to very detailed scientific questions on relative prevalence and a burden of hepatitis C. I mean, of course, what we do know is that for hepatitis C, there are actually quite effective interventions available. Those are very expensive, from what I understand. But obviously overcoming the challenge of access to effective interventions is a super important and critical aspect, but is really not very much within the remit of Global Health EDCTP3. Where we can come in is in, if there is an issue of implementation research for interventions that might be effective in the conditions that we do cover, then we can work on that, and indeed quite a few of our topics go in that direction. But the underlying price issue, if I may call it that, is not something that we have a direct impact on, except with the affordable access clause. When we fund a project, what comes out of it should then really help address this price issue. Thank you, and over.
Thank you, Emma. Thanks for that clarification. With this kind of exclusivity or inclusivity question, would you also propose that such a network reaches out to some of our scientific advisory board members to discuss this ongoing global health topics of discussion?
Well, I encourage everyone to really make their voice heard in this question of global equity and access to interventions. I mean, this is obviously a very complex discussion. And I certainly am really not well placed to comment on this. I just am aware, like an informed citizen, if I may call it that, of some of the situations. But I mean, this is quite challenging. I believe that the global community has found some ways to start addressing some of these issues. The way I understand it, it is so far mostly on very, on, let's say, particular conditions, like in the HIV field. I think there is a good way of having access to interventions globally. But, that is something that needs to be looked at, and indeed not just for interventions targeting infectious diseases. I mean, we have a high burden of non-infectious diseases all over the world, including in sub-Saharan Africa. And to some extent, we actually have the situation that paradoxically, sometimes effective interventions are actually cheaper in some European countries than in some other places with lower socioeconomic status. So, which of course is not acceptable. But this is not a discussion that where Global Health EDCTP3 is at the center. To some extent, through our topics, we try to address issues of, how can we get better access of interventions? How can we find better ways of making things available? If once you start to live, for example, in the vaccines field, our topic in the two-stage call is very much in that direction on how can we get effective interventions to the people that need it. So I think to some extent we are, trying to do our part from the research side.
Thanks very much for that explanation. Now, there is a question on one of the participants that is saying the country where I am based is not a part of EDCTP association. If they join in the next 6 months, will I be able to get the funding? I think, Jean-Marie, you mentioned this a little bit in your presentation. Can I pass on to you?
Yeah, I think if the aim would be for that country to be a member of the association before that proposal gets signed into a grant agreement, and that definitely won't happen in the next 6 months for that for the upcoming call. There will be moment to launch, moment to review, moment to negotiate the contracts. So if it is something in the process and you're sure that you'll be there before we sign those grant agreements, then yes. Having said that, it is it costs a lot of work and time investment for these proposals to be processed. So it is maybe my advice to the person who posed this question, if, as Tom was mentioning, if you are close to the institutions that make sure the joining of the association becomes concrete, then it's also good to do advocacy on your part, because it is something that we definitely cannot control from where we are.
Thanks very much, Jean-Marie. I think that's also a very important question for our participants, because they need to understand, I think Michelle's presentation also touched on this, that this restriction only applies if you are successful in the project as a consortium at the grant signing stage. Then our legal people will start looking at whether the country is getting the money in the association. So let's give a small scenario. If country X is not part of the association, but its institutions have joined a consortium, they have applied, and now the project is successful. That process, as Jean-Marie is saying, from now to joining, to writing the application, submission, review, decision of funding being made, maybe 9 months away. By the time you are being announced as the winner of the grant, that's where it really matters. And if, say, for argument's sake, by that time your country hasn't joined the association, then it's quite difficult at granting stage to determine that you get the money based on the status of association membership of the country in which your institution is registered. I think that needs to be really clarified, that you really can decide whether you want to be part of the application. But bear in mind that this can be an implication down the line if the country doesn't get into the association. And you could end up being asked to fund those activities yourself within the consortium. And that's where the hurdle is. So I hope that is clarified well. The next one is why are sub-Saharan African partners not the same between EDCTP2 and EDCTP3? Some countries that were part of EDCTP2 and are not part of EDCTP3. Michelle, are you able to get us through that?
So yes, for sure, the picture looks different from the second program to the current admissions. This, just to clarify here, that participation was open to all countries, Europe, as well as the African, sub-Saharan African member states. And the picture that you are seeing is just based on how countries committed and also the pace at which they responded to the call to commit to joining the association. And also just to remind everyone on the call that COVID changed, the pandemic changed the picture for most countries. And of course, their priorities have changed based on their experiences of the pandemic. So there would have been countries who would have wanted to continue, but their situation changed. But what we can say now is that participation remains open to all countries, and we hope that as calls are opened by the joint undertaking, more countries decide to join. And also just a reminder that countries can participate in the application process, but they must make sure that they have formally committed by the time the grant is signed. I hope that helps to answer the question, Tom.
Thanks, Michelle. And I think you also just need to clarify that this dropping off from the association has happened in Europe, but in Africa, the countries have increased. Is there any other country in Africa that was part of EDCTP2 and now is failing to renew its membership in EDCTP3?
We have had some countries, for example, like Angola, they have committed, but not formally joined us yet. It's just a change of ministry, for example, that has possibly delayed the process. So we have had a lot of expression of interest from the members in Africa, but they haven't formally completed their documentation, and this is based at a member state level. It's just the processes.
Thank you for that clarification. Yeah, thank you. So it's a procedural issue that is delaying others. Okay, then over to you again, Michelle. Do African states that want to be member of the association need to pay 700,000 euros every year?
So just the clear answer here is no, this is not true. It is, so remember we have contributions that are in cash as well as in kind, and the in cash contributions go towards, for example, if participating member states wish to contribute directly towards calls, and the in-kind contributions are, as we had described, activities that are in line with the objectives of the joint undertaking. The contribution that is annual is the administrative expenditure costs, and these are calculated based we have a calculation that is used where we use 40% that is fixed equally by all the members, and 60% that will be based on the GDP of a particular country. It is important here, just to fully answer this question, for the member state to please let us know who they are, and then we will calculate, because the costs vary based on the country. So how we work when we actually processing the process of the application, we have meetings with the member state, and then they take us through the process of, we actually will guide them on the costs. So long before the countries commit to joining the association, they are well aware of the amount, but it's definitely not 700,000 euros. I hope that helps to clarify the issue. Thank you, Tom.
I think it does, yeah. So just to emphasize what Michelle is saying, the 700,000 euros you saw in the slide is administrative cost. And so if African countries are supposed to contribute 10% of that, all African countries will have to just chip in for that 70,000 euros. And maybe, Michelle, you can just mention a few countries and what are the annual fees at the moment? For example, Sierra Leone, Malawi, and others. What does your calculation say? I think that will help.
Yeah, so these calculations were done by EDCTP Finance, and just an estimate overall for the countries. No one country in Africa, for example, has received an expense more than 5,000 euros, and this is annual cost.
Right. So depending on the GDP of the country and also its position, our finance team will calculate how much your annual contribution will be. And the figures I've seen is like country X, 1,500 euro a year, country B, 1,400, another country, 3,000 euros, which is not a big burden at all. It's something worthwhile to pay for a membership that you get millions of euros back. Thank you, Michelle. The next one, I'm cognizant of time. I think we are going towards the end, but yeah, sorry, Jean-Marie. Yeah.
Tom, if I may, the one you mentioned the aspect of being eligible for funding, but I would also like to remind us that by becoming member of the EDCTP Association, sub-Saharan African countries actually become full partners of the program and actually co-design the program. And this is actually and really happening. So as a secretariat, we get input from the EDCTP Association. And my understanding is that this is really collected in a very inclusive manner, and where the members of the EDCTP Association that are part of Global Health EDCTP3 really do contribute and have their voice. And I think that is why it is so important to join, so that we really address the issues that are of concern of the countries in sub-Saharan Africa. Thank you, and over.
Thanks, Emma, for that addition. And we have a few questions to end with here as I'm looking at them. One is about the EDCTP core, where one project received a score above funding threshold but was not funded. So the question, Irma and Jean-Marie, is that, do you know if the application can still be considered for funding?
Well, I would really prefer to discuss these things bilaterally with the projects rather in this open way. But generally speaking, we have informed consortia quite clearly about whether they are on the, selected for funding. And so we started grant preparation. We had very few projects whom we informed that they are on the reserve list. And then finally, we had quite a few projects, unfortunately, which we had to communicate that whilst they did get a score above threshold, which makes them in principle eligible for funding, but the available EU contribution was just not enough to fund these projects. I should also say, and those projects then from our side cannot receive additional funding, and they have been rejected in this situation. I should, however, mention that overall our success rate last year was really quite satisfactory. If you compare it to other EU programs, where I recently had a talk with a colleague where they have really extremely low success rates. We had overall success rate of more than 30%, and I think the lowest success rate for a given topic was like 20-some%. So out of this means typically we funded 1 out of every 3 projects that were submitted. We still have the issue that we cannot fund all good proposals, but I think this we share with many granting agencies. Thank you, and over.
Thank you, Irma. And quickly, we could end up with the last 3 questions. How will a scientific project leader be selected? Will this be someone within the consortium or anyone applying for such a position? And I think, as Jean-Marie said, I can quickly say here, this is not the EDCTP that dictates who is a scientific coordinator and who is a consortium leader. This is in your hands. This is how you want to structure yourself within the consortium. And this is what is presented to EDCTP, and they look at it based on the judgment of what you have presented. I hope that is clear. And the next one is, when you talk about having ad hoc partners, who exactly do we mean? I'm not sure whether we're talking here about the partners within the consortium or anything else. Jean-Marie, do you think you can interpret that and see what the question means?
Sorry for jumping in, but I think it may be actually about the ad hoc contribution by contributing partners, which is really at the program level. So it was in my part of the presentation, and indeed this may have been a bit confusing. So the meaning, what I wanted to say there was that, you know, the members of the EDCTP Association are our permanent partners, and they have rights and obligations. They sit on our governing board, as Michelle presented. And then we have also organizations that do not join the EDCTP Association or our joint undertaking as a full partner, and thus have no say in the governing board making decisions, but they can still send a letter to the governing board saying, we would want to contribute next year with, you know, a foundation may want to contribute on fellowships because they have, that is in their interest, and we have an interest there, and so then we can work together, and that would be an ad hoc, quote unquote, contribution from this contributing partner from this particular foundation to our program for one particular topic, very typically. Thank you, and over.
Thank you very much. And Emma, there is a question about Norway, which whether Norway can coordinate a project, but I would.
Yes.
Yeah. Yes, it can. They can. Okay. So, dear participants and colleagues, I think we have reached the end of our allocated time, and I see there are so many questions, some of which can be answered when we meet again in April. But if you feel that they're so urgent, please send them to our colleagues, many of whom have provided their email addresses during the presentation. Let me thank you, everyone, from wherever you were, for a very good session that we have had today, and gauging from the quality of questions that you have asked us, I have learned quite a lot, a bit more through this engagement, and looking forward to seeing you again for some of you who will join us again on 12th of April for the European session. So allow me to declare this session closed, and thank you very much again, all the participants and interested parties that are supporting the EDCTP3 Global Health Program going forward. Thank you.